Complications of osteosarcoma. The main complication in any malignancy is spread. Direct spread to surrounding structures. Blood spread. The main spread is blood spread to the lung, which occur early and mainly to the lung. Therefore, blood spread occur early. As we said in the microscopic picture, the blood vessels are thin-walled, malformed, infiltrated by malignant cells. And blood spread is very common in any sarcoma and spread here mainly and early to the lung. Lymphatic spread is very rare. Pathological fracture in osteosarcoma is very rare. Why? Osteosarcoma present mainly and early by severe pain. This leads to the patient is bedridden and cannot move the limb and cannot stand in erect position and carry his weight on his limb. Therefore, pathological fracture is rare and not occur. In this malignant tumor, as usual, there is anemia, cachexia, ending by this. One of the very common complication in this tumor is recurrence after incomplete excision. What is the clinical picture of osteosarcoma? Swelling, but we should notice that swelling is not the earliest manifestation. The earliest manifestation is pain, and after many weeks or months, the swelling appears. The swelling is fusiform in shape, hard or heterogeneous in consistency. Heterogeneous due to areas of hemorrhage, necrosis, and degeneration. Therefore, the tumor is hard, the degeneration is firm, the hemorrhage is soft. Therefore, there may be heterogeneous consistency. The swelling is ill-defined and metaphyseal, and this patient metaphyseal in the commonest site, in the lower part of femur. The skin overlying, because the swelling is usually highly vascular, therefore the skin overlying is warm and show dilated veins. If you concentrate, there are dilated veins, and this is evidence of hypervascularity of the tumor. And in case of high vascular tumor, there may be, if you palpate the swelling, you palpate pulsation and you feel thrill, and by auscultation there may be bruit over the swelling. This is the swelling which is not the main presentation. The main and the earliest presentation is pain, which occur early before the swelling. And as usual, pain from the bone is sewing, increasing by night, therefore interfere with sleep. And sure, it increases by movement. The patient may present by manifestation of complication, like manifestation of lung metastases, chest pain, dyspnea, cough, hemoptysis. The patient may have fever, cachexia and loss of weight. There may be low-grade fever. Because there is low-grade fever in advanced cases with redness of the skin and dilated veins, therefore the condition may be diagnosed wrongly as chronic osteomyelitis. As usual, due to hypervascularity in this area, the synovial fluid secretion in the nearby joint, in the knee joint in this case, may increase, leading to sympathetic effusion. What is the investigation of this patient? The investigation, first investigation as usual, is plain X-ray. And in plain X-ray, there is characteristic site, which is metaphyseal, and the characteristic age. How to know the age? This is the epiphyseal cartilage. Before epiphyseal fusion, before skeletal maturity. Therefore, it is usually teenagers and metaphyseal, characteristic site and age. There is areas of bone destruction, osteolytic, and the areas of new bone formation, osteosclerotic. Therefore, the tumor is osteolytic, osteosclerotic. And the new bone formation where? In the triangle, which is called the Codman's triangle, which is the triangle between the periosteum over the normal bone and the periosteum over the tumor. At the site of elevation of the periosteum, there is formation of new bone formation in this triangle, which is called the Codman's triangle. And these lines, calcification along the subperiosteal blood vessels, give sun ray appearance. And what is this? This is a soft tissue shadow due to infiltration of the surrounding soft tissue. There may be complete erosion of the bone. If there is erosion of the cortex, therefore this gives the bone what is called bone ghost. The remnant of the bone like a ghost. No characteristic shape of the bone. Other investigations, as usual in any malignant tumor, biopsy, etc. What is the differential diagnosis? Differential diagnosis for osteogenic sarcoma, first of all, other bone tumors like osteoclastoma, chondrosarcoma, other manifestations of other malignant diseases, as metastases or osteomyelitis. We said the condition is painful. Skin is red with dilated veins. Therefore, it may be diagnosed wrongly as chronic osteomyelitis. What is the treatment of this patient? This tumor is radio-resistant, no radiotherapy, but pre-operative radiotherapy and pre-operative chemotherapy and post-operative chemotherapy highly effective in early cases. Which means no metastasis, no evidence of lung metastases. In these cases, neoadjuvant chemotherapy. We all know that neoadjuvant chemotherapy means pre-operative chemotherapy. After pre-operative chemotherapy, which is neoadjuvant chemotherapy, surgery. The most popular nowadays is limb salvage surgery, or also called limb saving surgery. Limb salvage surgery or limb saving surgery consists of excision of the tumor, as in this patient, excision of the tumor with wide safety margin. But there is a wide defect. Wide defect is replaced by this. What is this? Replacement of this defect by prosthesis. This is the most popular surgery nowadays for osteogenic sarcoma. Indicated in if removal of the tumor with adequate safety margin can be done with the resulting limb after surgery has a satisfactory function. If we can remove the tumor with the proper safety margin and the remaining part of the limb has a satisfactory function, therefore reconstruction of the limb after surgery by prosthesis. This technique, which is limb saving surgery or limb salvage surgery, replacing the old technique. The recent technique, which is limb salvage surgery, replacing amputation. The rule in the past is amputation in the joint above the tumor. Example, if there is osteosarcoma in the upper part of the humerus, in the tibia, in the upper part of tibia, therefore amputation in the bone above the joint. The joint above is knee, and the bone above is amputation in the femur, which means above knee amputation. What is the indication of amputation? The reverse of limb saving surgery. What is? If we can't remove the tumor with proper safety margin, if the resulting limb has no function, therefore nothing can be done except amputation. Whatever the surgery, limb salvage surgery, which is usually done, or rarely nowadays amputation, post-operative chemotherapy is very important. Therefore, pre-operative neoadjuvant chemotherapy, post-operative chemotherapy, and surgery in between, which is usually limb-saving surgery. In advanced cases means with lung metastases. What is the treatment of this case? Palliative amputation, removal of the primary tumor. Palliative chemotherapy, and if there is single lung metastasis, it can be removed surgically by lobectomy. If the problem of the patient is only single lung metastasis, lobectomy with this will confirm the patient from non-operable to operable, and in this case limb salvage surgery or limb saving surgery can be done if it is only single lung metastasis. This is the main lines of treatment: the limb saving surgery or salvage surgery, and amputation with pre and post operative chemotherapy in case of early cases. In late cases, palliative amputation, palliative chemotherapy, or lobectomy for single lung metastasis. Thank you for good listening and good luck.